Hello, my name is Jackie Kirkup. Welcome to Spotlight on Surus. Today is Thursday, May 23rd, 2024. Today I have with me Lindsay and Roxanne, both registered massage therapists practicing here in Surus. Welcome to Spotlight on Surus, ladies.
Thanks, Jackie. Thanks for having us here.
Yeah, it's a pleasure to have you both. Well, I'm going to start with you, Lindsay.
Yes.
I know you're new to Surus, and
Yes.
so we'd like to learn a little about, get to know you.
Yeah.
So, for a registered massage therapist,
Yeah.
what is the education you need to complete?
So I went to Robertson College. At the time it was in Brandon. It's a 2,200-hour course. It's a lot, the whole massage therapy program is a lot more than just the hands-on stuff. You learn a lot of theory, whether it's anatomy or learning all the conditions that you may or may not see, and learning how to treat everything. There's a whole lot to it, and cramming that all into a 1.5 or 2 year program, it's intense.
It sounds like it. Yeah. My goodness, definitely a lot of things to learn. For sure. Yeah. I took anatomy and physiology at university. I did not pass it. Oh yeah, I was a failure, and it was tough.
It's a lot of memorization stuff.
Yes, absolutely.
Yeah.
Awesome. So what kind of clients would you see as a massage therapist?
So massage is suitable for anyone from infants to elderly. Like really, it'll apply to almost anybody.
So kind of, type of massage, or I think of as a type, you could be coming in and maybe just you want to relax, and that's sort of the massage you want to have, or you need something specifically, say, worked on and need help with.
Yeah.
Okay. Wow. So I guess I kind of maybe answered the next question, like why would you go to a massage therapist? So maybe can you give us some examples of conditions people may have that you may see?
So really, like if you work at a desk all day, if you're staring at a screen all day and you get daily headaches, for example, like massage may be a good fit for you. Or, if you're a farmer who sits in a tractor for 12 hours a day and you have low back pain, like those kinds of things is where massage would apply.
Right.
Yeah.
Okay. How long would a typical massage be for?
So I usually do mostly 60-minute appointments, but I do as well do 90-minute appointments or 45 or 30 minutes.
Right. Okay. So a good variety of depending on people's schedules.
Exactly.
I bet. Right. I was just also going to ask you, and actually I've lost my complete train of thought, so I'm sorry. So I'm skipping my question. What additional courses have you taken since becoming a registered massage therapist?
So I have since added to my practice cupping, and I've taken a taping course like kinese tape. And I've just added hot stone.
Oh, wow.
Yeah.
I've had a hot stone massage before, and it's lovely.
They are wonderful. I'm so glad that she was able to add these courses.
Yes.
I've been waiting for her to add those.
That's amazing. I was going to ask you, Lindsay, how long have you been practicing as a massage therapist?
I have been practicing for just over 2 years now.
Wow.
Yeah.
Excellent. Yeah. And so much education. To keep building your practice and offering different things to your clients. Wow, that's amazing. So, Roxanne, we're going to turn over to you. I've known you for an extremely long time. And ever since you moved into Surus, I've always known that you've been a registered massage therapist. 30 years.
I know. When I went to look at what this is, it's like 34 years ago I graduated from massage. I could not believe it's been that long.
Wow, that's amazing.
Lovely. Yeah.
So I am certain you've seen many changes in your practice over the years. Can you tell us a bit about those changes for you?
Yeah, there has been a lot of changes. I was really lucky enough to work in 2 different provinces as well. So as I came to Manitoba, I ran into a couple of people in Brandon that also did homeopathic medicine, which I thought was really cool. And it didn't take long for me to go into that program and have to go back to school again, because going back to school seems to be things that massage therapists love to do. So that was a 4-year program. I was able to take it in Winnipeg. And when I still had my practice in Brandon, I did do a lot of homeopathic services there. Here in Surus, once I had the kids and moved the practice back just to here, I found that it was a little easier for me to just work more on the massage therapy portions. Okay. But now that the kids are gone, I can work a little bit more back in with my homeopathic clients again, which has been really nice. And then I started finding that my hands were starting to feel a little funny. They were aching a little bit, which is very common for a massage therapist. Sometimes massage therapists don't last any more than 10 years.
Oh, so my goodness.
Wow. I felt very blessed to even work as long as I did, until, of course, I found Lindsay.
Yes.
Which was fantastic.
She's got brand new, strong hands ready to go.
We have new blood. Yeah. So that's been really good. Lindsay has now taken over the table massage, what they call Swedish massage. Okay. She's taken over that part of the practice, which allowed me to focus more on my Thai massage.
Okay. I'm interested to hear about Thai massage. I don't know really anything about it.
Worked on Thai massage.
No.
Even before Lindsay came along, I was going back and forth between 2 rooms doing Thai massage and the Swedish. So now I just concentrate on the Thai massage at the office. And the Thai massage is a little bit different. It is what they do in Thailand. Okay. You are on a nice big thick mat on the floor. There is no oil. You're just in what we call yoga workout clothes. Okay. And it is a lot of stretching. It's a lot of pressure and movement. So more working on movement of the joints, lots of mobility. I never like to claim that I can increase your mobility and everything's,
wonderful. Yeah. Get off the mat and just walk out, no
and
problem.
Walk away.
Right?
But it is something that we work on. And kind of the whole theory of it is if we can work on our movement and on our mobility in our joints as we age, this makes things a lot easier for us.
Right.
As we're
So the typically sort of the patients that or clients you may see, does it vary in age for the Thai massage?
It does still vary in age because I have a couple of young athletes who are 10 or some of them even younger, who may be baseball players or goalies, and they like to come in regularly to have that worked on.
Right.
On the contrary, even people who think they can't get on and off the floor on the mat, we always have a way. And
I'm certain you do.
Yeah. And so we do, even someone who has mobility issues, we still get you on and off the mat and work on some of those hip motions and getting more flexibility and fluidity in those joints. So, yeah, really wide variety.
Wide variety for sure. How long does a typical Thai massage last for?
So Thai massage is really nicer if it can last longer than a traditional massage. Okay. So 1.5 hours is what I like to work with. Some people prefer to stick to the hour, but 1.5 hours is ideal. Even 2 hours is not uncommon at all. Wow. It's very slow and methodical. Okay. Almost think of it like the flow of a yoga session. Okay. So everything's nice and slow. Right. It takes time for the body to readjust within that session. Yeah. So,
wow. Yeah. Sounds very interesting.
1.5 to 2 hours.
Okay. Well, what a nice compliment to have to the practice that you already had established and to exploring some other things to offer your clients.
Well, and I think that's why one of the other things that I have recently taken is my pelvic floor therapy training, as well as that kind of came into play with my Pilates instructor. Okay. So I'm still working on some stuff with Pilates, but I have finished my Pilates reformer, which is the movable table. Yes. It's a great place. Yeah, it's very fancy.
Do you have this table,
Roxanne? I do have the table.
Oh my goodness, you and I are going to chat after this.
I do have a table. And so I had originally got into this because I had a lot of people. Part of the advantage of having your clients with you for over an hour is you get the opportunity to talk about a lot of things that they need and what the public needs in general and what's missing in our area or what there are shortages of. pelvic floor therapist was one of the things that there is a lot of shortage of. So when I took my program and my Pilates reformer, that was kind of part of the progression of doing these things. However, the Pilates table can be used for so much more. I've been using it for hip or knee replacement, prehab, the pre stuff, as well as the rehabilitation from that. But even just generally, women post pregnancy, even maybe where they need a little extra movement. Again, generally as we age, there's things that we need to strengthen, things we need to stretch.
Right.
And the Pilates reformer is just such a wonderful way of doing that, so that then you can move into doing Pilates mat, where you're put on the floor using your own body weight.
Yes.
So that's my next course. That's coming up in the fall. Already registered.
Yeah,
I'm ready to take
sound
it.
sound very busy, and it doesn't just stop.
It never
know?
stops.
No.
Nope.
It never stops. I mean,
It's always something more.
that you can
more.
go
Yeah.
into. And I
Right.
think that's one of the wonderful things about taking massage therapy is it's such a great base. And even though we haven't done it, other people have gone into so many other avenues with massage therapy that anybody out there thinking about taking massage, it's not just one of those professions that you just stay in the massage business.
Right.
You're always progressing
Right.
and moving
Right.
as a base into other things.
Is there a shortage of massage therapists in Manitoba, or are you aware of that, or?
In rural Manitoba?
Yes.
Okay.
Absolutely.
Yeah.
A matter of fact, we were just at the Manitoba conference, a massage conference, and there was a whole table of us from rural Manitoba. And we're like, do you have room? Like, can you take clients?
Wow.
Do you have
Yeah.
room? It's like, no, I've got a wait list that's 6 weeks. I've got a
Isn't
wait
that
list
something?
that's 2 months. And so there is a real shortage here.
And a
Otherwise,
good
people are
problem
driving.
to have a waiting list, right? But
It's
also not
great.
the
Yeah.
best problem for the people that do need to
Yes.
Well,
to see someone and get some care.
That's right, because part of the problem is you go into massage therapist because you're a person who wants to help people.
Right.
And
When you can't help everybody,
Yeah.
it hurts.
it
Yeah,
does.
absolutely
You
it
really
would.
feel it
Yeah.
personally.
Oh, sounds like a great compliment the two of you have with your two different things going on in your office.
Yeah, well, and
Yeah.
we're really lucky, just in general, to have such a wellness clinic that we work in.
Mm-hmm.
You know, we work in with Souris River Chiropractic, we work in with Current Wellness, we work in with Soul.
Yes.
Um,
Reflexology.
Yeah,
Reflexology.
yeah.
Yeah.
So it's a lovely place to be.
Yeah,
Just
Yeah.
it
in
is
the
a
whole
one-stop,
complex.
shop.
Yeah,
it's lovely.
You know, when you think about the wellness
Yes.
aspect of things and the different practitioners
Right.
that you can see to help
Yeah.
you out.
Yeah.
So much
Oh,
fun.
yeah, so much fun.
Yeah, and for me, as like I was young when I started, like I came to this clinic when I was 19.
Wow.
So working with Roxanne and Blake and Carissa and Laura, like learning all what they had to offer and like bouncing ideas of like, okay, I have this person with this going on, what should I do? It was just amazing.
It's
Wow.
a wealth of knowledge that you
Yeah.
can all.
Yeah, I
Work
bet I
together
I
on-
could just sit, if you ever get time to sit around and have coffee together.
No, we don't.
It would be quite a conversation.
A matter of fact, we actually say, it's like, oh, I didn't see so-and-so today, or when have you been in lately? Because we're all working in our
Yeah.
rooms at different times.
Yeah.
Well, I know the question I was wanting to ask you, Lindsay, is when a person first comes to have a massage,
Yep.
do they come for an assessment first and then maybe make another appointment
Yeah.
later for the massage, or does it happen all at once?
It kind of depends on what they present with.
Right.
Like if it's just kind of a general like, oh, I work at a desk, my shoulders are sore, then it's not really, it doesn't set me up for an assessment.
Right.
Whereas if it's like, okay, this new thing has started and I think I pulled this or whatever, then I can do some orthopedic testing to
Okay.
figure out what specifically it is that's going on. And I do tend to, especially with new clients, I take kind of a postural assessment as they're walking in the door. I
Right.
just pay attention to how they're walking, how
Yeah.
they're standing, all the things. So a lot of it happens without the clients even knowing.
Right.
So then we can focus most of our time on the treatment itself.
Right. Okay.
Yeah.
Well, that's good to know, and I think that's good for the viewers to also know if they're
Yeah.
considering coming for a massage, sort of
Right.
what they can expect when they come. Well, it's been a pleasure having you ladies here. Did we cover everything?
I think we have.
Awesome. Well, Souris is very lucky to have both of you. here practicing, in Souris, and that there are many different types of things that people can access to help with their health and well-being. So it's lovely to have you. These ladies are in the same office as Dr. Dembo, and they would love to see you sometime.
Absolutely.
Yeah.
Questions are always welcome.
Excellent. Great. This has been Spotlight on Souris.